Hello, my name is Kimberly Gao. Today we'll talk about cystic fibrosis and how it's inherited in our family. I will use a pedigree to explain the inheritance pattern, the gene involved, and the effect of the disease. This slide shows a 5-generation pedigree of cystic fibrosis. Each row represents a generation labeled from 1 to 5. Each person is numbered and connected by lines showing family relationships. The diagram includes males, females, affected individuals, and carriers. As seen in the generation 1, individual 1-1 and 1-2 are both unaffected, but they have an affected child 2-3. This means both parents are likely carriers with genotype of big A, little a. In generation 3, individual 3-2 is affected. This means this person must have a genotype of 2 little a's because they show the disease. In generation 4, individual 4-2 is affected even though the parents are not affected. This shows that both parents must be carriers and the disease is recessive. Based on this pattern, cystic fibrosis is inherited in an autosomal recessive way. Affected individuals are homozygous recessive, while carriers are heterozygous and do not show symptoms. Cystic fibrosis is an autosomal recessive disease. This means a person needs two mutated genes to have the disease. If a person has one mutated gene, they are a carrier. Carriers do not usually have symptoms. This disease affects males and females equally. It can also skip generations. Now I will explain the genes that causes the disease. Cystic fibrosis is caused by a mutation in the CFTR gene. This gene is located on chromosome 7. It produces a protein that helps move chloride in and out of cells. This protein is important for normal cell function. About 70% of cases are caused by a common mutation called phenylalanine with a deletion at the 508 position. Next, I will explain how this mutation affects the body. The CFTR mutation causes problems with chloride channels in sweat glands. Chloride is not transported correctly. This leads to high salt levels in sweat. In other glands, the secretions become very thick and sticky. This thick mucus causes many problems in the body. So now I will talk about the symptoms of cystic fibrosis. The lungs are the most affected organ. Thick mucus blocks the airways. This makes it hard to breathe and clear secretions. Bacteria can grow easily in the lungs. This leads to infections and damaged lung tissues. Cystic fibrosis also affects the digestive system. The pancreas can become damaged, which affects digestion. This can lead to diabetes. The liver and intestines can also be affected. Some patients may have bowel obstruction. Finally, I will discuss how the disease is diagnosed and treated. Cystic fibrosis is usually diagnosed with newborn screening. This test looks for mutation in the CFTR gene. A sweat test can also be used to measure salt levels. Treatment includes medication that improves CFTR function. These treatments help manage symptoms and improve quality of life. So in conclusion, cystic fibrosis is an autosomal recessive disease caused by mutations in the CFTR gene. It affects many systems in the body, especially the lungs and digestive system. Understanding the genetic pattern helps explain the disease is passed through families. And these are the references used for this presentation. Thank you.